So I understand you've been refusing your medications and instead requesting some magical traditional treatment. Here at this hospital, we provide evidence-based medicine. We don't have time to learn or incorporate your frivolous ideas.
But this is a home remedy that has been used by my people for 100 years. I can have someone from my community come explain to you why it's used. I'm very unfamiliar with the drugs that the nurses keep bringing me, and I don't know how they work.
You're not going to get better if you don't start complying with our treatment. If you don't want what we have to offer at this hospital, then you shouldn't have come here in the first place.
Okay, but I'm not familiar with all the pills, like I said, and sometimes they bring me 4 and 5 pills at a time. Would you just take pills that you never heard of before?
I don't know what this is, but I don't want you taking anything that doesn't come on a food tray or is given to you by a health professional in this hospital. I would take anything prescribed to me because as a doctor I know best.
Okay.
Also, your family's been kind of getting in the way of the nurses and myself when we're trying to do your treatments. This is not a hotel. We can't have people crowded around your bed at all times of the day.
But they aren't trying to cause trouble. And we know it's not a hotel. It's just part of our culture to have family members around. We live 2 hours away and it's hard for them to come back and forth. And they always say prayers at my bedside to keep the spirits away.
Your blood glucose has nothing to do with spirits. It has more to do with your poor diet and sedentary lifestyle.
But that's what we believe in.
You're getting close to discharge. Start complying with your treatments and listen to the nurses, please. And stay in your hospital room. You don't need to be out in the garden smelling flowers when they're trying to give you your pills.
Okay.
Caucasian individuals are considered to be placed in a mantle of invisibility because these people don't notice they're a race themselves since they are a part of a norm in society, just like the doctor showed the client. People that display whiteness have 3 categories: identity, which represents how they see themselves, an ideology and institution where they only will focus on Western health and Western medicine and disregard other cultures and traditions. The doctors display this by ignoring the client's health traditions and only want to focus on what he knew, which is Western medicine. Racism was also displayed by the doctor when he asked stereotypical questions to the client. Race is man-made to place people in the groups, however it can shape the client's health and well-being. Racism in the clients can also lead to negative attitudes and beliefs, and it can also lead to inequalities in health. What would have been better would be to ask the client what she would like for her treatment, rather than ignoring her request. Western education should also be taught traditional medicine as well as Western medicine, since society is becoming more multicultural.
Western medicine and psychiatry often stigmatize Indigenous healing as the other. This causes a sense that Western medicine is considered better and more valuable than Indigenous healing practices. This condescending attitude undermines the belief systems of these peoples. As a result, a hierarchy is formed which acts as a barrier to finding a combined approach for care, or a two-eyed seeing approach. It is important to understand that the base of these barriers is a direct cause of power and privilege that comes from racialized status, or whiteness. It is important to understand the unique conceptualizations that various cultural groups hold about illness because healthcare providers might misdiagnose individuals. It is also important to note that even though their beliefs may differ, most Indigenous cultures do not believe that human agency and reliance on health professionals are a violation of their spirituality. This means that these groups are open to healthcare from a Western approach. This highlights again the need to be culturally competent as a healthcare professional, to respect the beliefs of the individual, and to plan a course of care that will improve health in collaboration with the patient.
Western medicine and alternative medicine differ greatly. Western medicine tends to focus on science and separates the mind, body, and spirit, treating each as an individual entity. Alternative medicine, however, tends to focus on a more holistic approach to treating illness. Many alternative therapies are used by Indigenous people to treat illness, and like in this situation, alternative therapies are often discounted as credible by those practicing Western medicine. Herbal remedies play a very large role in alternative medicine, as well as the healing process and well-being of many Aboriginal peoples. The importance of the client consuming our herbal tea should not have been overlooked or criticized by the doctor in this situation. Instead, the doctor should have arranged to collaborate with the pharmacist to ensure this tea would not be harmful to the client or interact with any medication she is taking. It would also have been beneficial to work alongside the client to incorporate her herbal remedies into her treatment plan for the future.
Family and social supports are very important to many Indigenous groups and often need to be part of the patient's care team. A healthcare provider may dismiss the family or community members as integral people in the patient's life, therefore interventions can become ineffective. There needs to be a holistic view to patient interactions and not a sole focus on physical or mental conditions. When families and all of the holistic aspects are taken into consideration and used in practice, there is more success seen in treatment and families report being happier with outcomes. Sometimes it may be seen that the family or community member may be talking for the patient during interactions, and a common practice would be to prompt the patient to answer for him or herself. However, in some Aboriginal communities, these people are seen as equally important in client needs and are often vital in gaining insight and information. Including them in the health discussions or patient education can likely benefit not only the client but also the health outcomes. Asking questions and familiarizing yourself to the client's culture, background, and life experiences will allow the patient to inform you who they want associated or included in their care.
Indigenous groups around the world share particular commonalities. The most significant is a history of colonization. Many traditionally migratory groups have been forced to become stationary and to adopt a Western way of living. Indigenous people have lost land and with it the resources it offered. Because of their largely involuntary adoption of that Western lifestyle, many Aboriginal people live with insecurities with food, housing, employment, and income. Having been colonized and forcibly alienated from their environment may be a factor closely linked with the many health issues that affect Indigenous people. Most Indigenous people believe that a defining characteristic of indigeneity is their strong connection with the environment. The people are the land, and the land is the people. It's important to recognize that for Indigenous groups, nature is more than a scientifically observable construct. Health is holistic, all the components are intertwined and must be addressed in order to create a healthy whole. Healthcare should take into account this deep bond and incorporate the broader environmental aspects of life.
Spirituality is hard to measure. It has many different definitions and meanings, some of which include experience of mutually rewarding encounters between people, communication with the environment, and access to heritage. At the center of spirituality is the cultural characteristics in which a person's identity is revealed. Spirituality is very important to Indigenous people. According to an article by Mason Dury, 2004, health of individuals is achieved through an holistic approach, in the sense that good health is seen as a balance between mental, physical, social, family, and spiritual dimensions. People believe that wellness should be the aim of an intervention, not just the removal of symptoms, as depicted in the video by the doctor. In fact, wellness depends on many more factors and variables than what can be achieved through treatment or an intervention. It has been proven that many health professionals are insufficiently resourced and unskilled to address the wider social, economic, and cultural issues, all of which lead to wellness.
According to Waldron, the health system is based on Euro-Western health as a standard form of healthcare, not taking into consideration the cultural beliefs, traditions, and systems of other culturally diverse health beliefs, which leaves some unsatisfied with the care and others less likely to access healthcare services. With lack of access to healthcare, it leaves them with poor health outcomes than the ones that have access. We should be looking at the reasons why they are not accessing healthcare. If we are not being culturally competent in our care, because we assume that our way of medicine is better or the only way, because we assume Indigenous medicine is naive and behind Euro-Western, then this leaves others feeling like healthcare services is not an option for them. We should be looking at as a cooperation between Western medicine and Indigenous, with both learning and understanding about each culture and medicinal ways and integrating that in our practices. Americans are starting to look at holistic healthcare as a viable option to complement the Western medicine to reach a feeling of wellness. That we should be looking into the effectiveness of other options to give the best care we can for our clients.